Allan.
Deputy Speaker, and it's a pleasure to follow the Right Honourable Lady opposite, who has made some very useful points on how we may, as a House, better scrutinise and better be involved in some of the decision-making process. I'm really grateful that we have this opportunity to debate this subject today, and it is the first such time that we do. I will start by thanking all of those who've worked so hard, not just the people on the front line, but ministers too, trying to grapple this awful virus. I do not envy them the burden of their responsibilities, and I know they are doing their very, very best at this difficult time, and not all will go well first time round. And they do deserve our thanks from across this House. Now, it's widely accepted that COVID is here for the long term, and this being the case, we do have to learn to live with it. And as the Chancellor said so eloquently last week, we have to learn to live with it without fear. We know that lockdown is not a cure. The restrictions give us temporary respite, but we are waking up now to the full cost of what that temporary respite means, not just in terms of livelihoods and jobs and people's futures, but suffering and sacrifice that so many have endured in different ways. So I say that long-term lockdown is not a solution. It is not living with COVID. In fact, in many ways, it's hiding from COVID. It's simply hoping it will go away. And we know there is much that we can do to protect ourselves, our loved ones, and our communities. And we've seen the measures that shops and schools and pubs and restaurants take to stop the spread. And individually, we have learned to adjust our behaviour. So what we now need is a long-term strategy. It's a long-term problem. We've got to approach it from first principles. We need a sense of perspective. The measures we introduce on the whole population need to be proportionate to the risk. And it is understandable that back in March, decision makers felt a sense of panic. But now we know much more about this terrible, terrible virus. And we know about the groups that are most affected. And we know that the horrifying worst-case scenario numbers we were given were never realised. So now we can be smarter and more targeted in our quest to prevent avoidable deaths. There is no need to impose indiscriminate, sometimes arbitrary or capricious restrictive measures on everyone. This is a new virus, and the science is young. Unlike the scientists, government has to consider wider issues, not just the science. Government has to consider the impact of lockdown on the economy, of course, and the impact on our health, but also the social consequences, the moral consequences. It has to grapple with the big picture issues, such as the value of freedom and democracy, and it also has to decide whether a COVID death matters more than any other preventable death, and I say not. It also has to bring the people with it. Now, we all know those who are most in need of protection, and we can understand why they need protection. But it's far less easy to understand why we are locking down students who can be safely exposed to the virus when we do not place similar restrictions on the people most at risk. We need to understand risk, we need to understand probability, and we need to understand robust, evidence-based data really matters. It's very uncomfortable being frightened to death by scientists presenting charts to the nation that they must themselves know are wrong. That chart last Monday undermined public trust, quite clearly pushing a worst-case scenario without telling us the probability of such a scenario occurring. Was it designed to instill fear in order to control the public? Is that how we want to govern? Now, emergency powers were given to government when this was an emergency, and that was the right thing to do. But we all accept we've moved on from there, and I would urge the government to understand that we now need to involve members of Parliament in this process in a different way to that which has happened so far. We may not be experts in science, but we are experts in the people we represent. Day in, day out, we are engaging with our constituents, with their needs and their concerns, and it's to our constituents that we owe a duty. So I do ask ministers to allow MPs to bring that knowledge and expertise, as I genuinely believe that would aid decision making. I just would like to end by saying that I do thank every member of this government who has worked over recent months. They have my total admiration. And no, it's not possible to get things right every time. And I applaud them for being so brave in keeping on going despite some of the difficulties and challenges that they have experienced. But I do ask that they challenge the science with pragmatism. Do not be blinded by it. Science is often as much about opinion as is politics, and we should never be disregarding the people that we were sent here to serve.